The Hot Hub is for patients who are showing COVID symptoms, so you might be asked to attend here if you have high temperature, if you've had a recently developed cough, or if you are losing your sense of smell or taste. The benefit of having a Hot Hub site that's away from our surgeries is that we can focus on our COVID symptom patients and give them a safe and effective service, whilst also maintaining routine work for our patients back at our practices. This means we're not going to ignore people with minor symptoms or major symptoms that they might be worried that they'll be interrupting or bothering the NHS service at the moment. You're not bothering us. Please come and see us and please come and use the services. We're doing everything we can to keep you safe. And this has been a huge part of enabling us to do that and keeping COVID away from our surgeries, but we're still looking after our COVID patients. When a patient arrives here, we're going to ask them to remain in their vehicle. Don't come to reception, please don't come into the building. We'll come and meet you from your car. When the clinicians come to meet you from your vehicle, they will be in full and total PPE, and then if you haven't got a mask yourself, you will be provided with a mask. You will then be assessed briefly in your car, and if it's deemed that we still need to see you, we will then bring you in through a dedicated entrance straight into a dedicated suite where we can assess you there. On site, the practices have worked collaboratively and have a joined up IT system whereby we can access all patient records while we're here. So if there is any ongoing care that's required after visiting the site, we can do that, and we communicate in between all the surgeries on a daily basis to ensure that that work is carried out effectively. If you need to be referred to a hospital or you need to be referred for blood tests, that will happen and that will be managed from your surgery. Unfortunately, we are unable to offer COVID tests at this site. That's still being maintained either at the hospital or at dedicated sites. This is for GP surgeries to enable us to assess COVID-like symptoms or people that have been diagnosed with COVID that may have exacerbated symptoms or maybe having unrelated symptoms that we need to check out. So a huge advantage to the Hot Hub being located at the Liskeard Community Hospital is that we are working collaboratively and alongside the minor injuries unit. This has given us a huge advantage in that we can sometimes immediately refer people if they need to have things done, and it's improved communications and relations with the minor injuries team. It's better now than it's ever been, and it's only going to get better. It's not just siloed care anymore where you see a GP or you see a hospital. We're now working together to provide the best possible care we can do for our patients. Please don't be concerned about going to your GP surgery. As you can see, we have plenty of safety measures put in place to protect you and to protect our staff. That is our priority and our key. We've put lots of mitigating procedures where we're putting COVID-related patients off-site, and then anybody that needs to be seen routinely, needs to have their immunisations, or just has any sort of ailments that they want to be addressed, please, please, please do contact your surgery. We are open for business and we do want to see you.